So prostate cancer is no big deal, right? Every man gets prostate cancer if they live long enough. What's the scoop? Hey guys, it's Doc Heps here with UroCoach. So the question is, what's the deal with prostate cancer? You've heard it's not a big deal at all, that most men die with it, not from it, and that most men actually have it as long as you are old enough. So is prostate cancer a big deal, or is it just something you can ignore? So first off, what we're going to talk about is a few facts about prostate cancer. Number one, prostate cancer is the second leading cause of death in men after lung cancer. About 35,000 gentlemen die a year of prostate cancer. About 270,000 men are diagnosed with prostate cancer a year. So it's a very common cancer that we diagnose frequently. And although there's a much smaller amount of men that die from prostate cancer, it's still significant. It's the second highest cause of cancer deaths in men. Men who are African American have a higher risk of being diagnosed with prostate cancer and having metastatic or spread of disease, as well as dying of prostate cancer. So that being said, prostate cancer is diagnosed at an early stage in 80 to 85% of men. And diagnosis of prostate cancer at an early stage means that 95 out of 100 men will survive at least 15 years. So in general, if prostate cancer is diagnosed at an early stage, it likely won't bother you. It can either be watched if it's very dormant indolent cancer, or it can be treated in an early stage and highly unlikely that it will ever affect your life. If prostate cancer is diagnosed at a higher stage, though, such as after it spreads, that risk of death is very high. Only about 30% or 1 out of 3 men will survive 5 years. So this is really a shout out to diagnosing prostate cancer early. So how do we diagnose prostate cancer? Well, that's for some other videos, but I'll briefly go over that it's a combination of utilizing a PSA blood test, a prostate exam. MRI of the prostate is often helpful in diagnosing or helping us discover and find prostate cancer. Ultimately, a prostate biopsy is the only way to confirm that there is prostate cancer. And it also guides us as to the type of prostate cancer, whether it's a dormant, latent, indolent, non-aggressive tumor versus a tumor that has a propensity to spread or metastasize and cause trouble. We use these tests, and you and your doc would decide whether a prostate biopsy would be appropriate. And you get a pathology report. And either that report says, hey, there's no cancer there, all the cells are benign, or it may say, hey, there's prostate cancer, and it will grade the type of cancer. It will put a score on it called a Gleason score. And that comes in scores 3, 4, and 5. And that's based on the architecture of what the cancerous cell looks like. Cancer cells that are 3s have generally a very indolent, latent, non-aggressive course. And oftentimes, if there's only 3s there, we leave that cancer alone. We perform what's called active surveillance. That's the type of cancer that you die with, not from. Now, in men who have cells that are graded as 4s or 5s, those are more aggressive tumors. Those can have a predilection to potentially grow and proliferate and spread. Prostate cancer generally will spread to the lymph nodes and also the bone, but it can really go anywhere. So our job as urologists is really to decipher out who do we need to evaluate for prostate cancer, and if we need to evaluate him, which cancers do we need to treat and which ones can we watch? And the combination of the PSA, the exam, imaging studies to include an MRI and possibly a PET scan, as well as what's most important is a biopsy and the Gleason score. Sometimes we'll use additional genetic testing. We put that all together to decide, hey, is this gentleman something that has prostate cancer that we can just sort of watch and monitor, and he's unlikely to have problems with it? Or is this something that we should treat now that we've discovered it at an early stage to prevent it to progressing, well, where it would potentially cause him problems? Ultimately, whenever you hear that there is cancer, the big C, it can be very emotional and lots of thoughts go through your brain. But stick with the facts and know that the vast majority of gentlemen who have prostate cancer have early stage disease. And some of that early stage is very low grade and may not need to be treated. But in those other gentlemen who have early stage diseases, we can effectively treat them, and their survival overall is well over 15 years. Now, in those men who have prostate cancer that's truly aggressive, and that's in the minority of men, but it still exists, those men, we have to be much more aggressive in the treatment, and oftentimes we'll work in collaboration with the medical oncology team to help optimize their treatment plan. Overall, prostate cancer can be a deadly disease. As I mentioned, it's the second leading cause of cancer deaths in men, but most prostate cancers can be effectively treated and identified at an early stage. So that's a great reason to continue to see your primary care, continue to visit your urologist, undergo routine PSA testing, as well as prostate exams. Hopefully this video gave you some insight into whether prostate cancer can be a big deal or not. Appreciate your time. Thanks for watching. Make sure you subscribe to our channel. Thanks again.